Good day everyone and welcome. What you are seeing here is a clip of two little ones using inhaler. My heart's raised. They are just so little. The medical issue here is that our mind often jumps straight to asthma. And yes, that is the usual suspect. But there is a deeper story. If you believe I'm doing something meaningful, please click the subscribe button, drop a comment and share before we dive into the medical related issue pertaining to this case. Thank you. God bless you. Common reasons why people use inhalers. Number one, asthma. Asthma is the most common cause of inhaler use in children and also in adults. Asthma is a condition where the airways get tight, swollen, and produce extra mucus when they are triggered by dust, or due to cold air, or due to rigorous exercise, or due to infections or allergies. And it has symptoms like coughing, trouble breathing, chest tightness. And the function of the inhaler is to help to relax the airway muscles and also help to reduce swelling and also help to make breathing easier at night. Is asthma genetic? Yes, asthma can be genetic, but it's not only genetic, it can also be triggered. Let's talk about the genetic aspect. If a parent, especially the mother, has asthma, the child is more likely to have it too. And asthma is often seen with other inherited conditions like eczema, allergies, fever. All these three inherited conditions are known as the atopic triad. Another thing is environment. The environment also plays a bigger role. Even without a family history, a child can develop asthma if exposed to dust mites, smoke, cold air, or infections, especially in early childhood. So another thing we have to know is asthma is equals to gene plus trigger. Genetic load the gun, the environment pulls the trigger. A child may inherit sensitive airways, but asthma only show up when those airways are triggered. Number 2, bronchiolitis. Bronchiolitis is common in babies and toddlers. Actually, it's not genetics, but it's a viral infection. It often causes RSV. RSV is also known as respiratory syncytial virus, and this virus affects the small airways in the lungs, and this virus can be spread through cough, sneeze, or touching of contaminated surface. It has symptoms like fast, shallow breathing, cough and wheezing, blocked nose, and feeding problem in babies. The inhaler role here is to open airways if the child has trouble breathing, especially in repeated infections. Number 3, chronic bronchitis. Chronic bronchitis is also known as the ongoing mucus in the lungs, and it's a long-term inflammation of the airways causing constant mucus and coughing. It has a series of causes like repeated chest infection, living around smokers, air pollution, poorly treated asthma, and it has symptoms like constant cough with mucus, difficult in breathing, and the function of the inhaler here is to clear airways and reduce inflammation. Number 4, acute respiratory distress syndrome, ARDS. Actually, it's not genetics, but it's a serious condition where the lungs suddenly fill with fluid due to severe infections or accidents. And it has a series of causes which are severe pneumonia, blood infections which is known as sepsis, and inhaling harmful substance, drowning, and it has symptoms like severe difficulty in breathing, and also the requirement of machines which helps to breathe. And the function of the inhaler here is to maintain treatment, but may not be used during recovery. Number 5, immotile ciliary syndrome. This is genetic and it's also known as the primary ciliary dyskinesia. It's a rare genetic condition where the tiny hair-like structure, which is also known as the cilia in the lungs, doesn't move properly. This cilia normally sweeps mucus and germs, and it has causes like when it is inherited from parents, that is when it is run in the family, and it has symptoms like blocked nose from birth, constant cough, frequent chest infection, and sometimes organs may be flipped inside the body, e.g. heart on the right. And the function of the inhaler here is to help to manage symptoms like airway tightness and reduce chest infections. Genetic effects of immotile ciliary syndrome. Number 1, it can cause infertility in male and female. So in male, We all know that sperm have tails that are also made of cilia, and if immotile, sperm can't swim, and therefore it will lead to male infertility. And also in female, we are also familiar that fallopian tubes have cilia to move eggs, and if impaired or immotile, there will be a risk of reduced fertility or ectopic pregnancy. And another thing is situs inversus. During the first few weeks in the womb, cilia helps to determine the left-right orientation of internal organs. If the cilia are immobile, that is, when they are not moving, the signal that tells the body where to place the organs can be faulty. This can cause a condition called the situs inversus, where the heart is on the right side of the chest instead of the left, and other organs like the liver, spleen, stomach may also be flipped. Another thing is hearing loss. So, the cilia in the esophageal tube normally helps to move our mucus and fluid out of the middle ear. So once this cilia is lost due to immotile ciliary syndrome, it can cause thickness of the middle ear lining. Number 6, cystic fibrosis. Cystic fibrosis is a genetic disease where the body makes thick, sticky mucus that clog the lungs and the digestive system. Causes of cystic fibrosis is due to genetic inheritance from both parents who carries the cystic fibrotic gene, and it has symptoms like constant coughing, repeated lung infections, poor growth despite good eating, salty or tasty skin, and the function of the inhaler here is to loosen mucus and reduce inflammation. Respiratory issues in toddlers are more common than many people think. Their lungs are still growing, their immune systems are learning, and their airways are so small that even a little mucus can cause a big problem, whether it's asthma, bronchiolitis, allergic reactions, or something deeper. Early attentions and gentle care can make all the difference. Nursing mothers with these medical related issues that we've discussed should always listen to your child breathing, use medication exactly as prescribed, create a clean, safe breathing environment, don't skip checkup, stay calm. Your calmness reassures them, and let's lead the care with love. Thank you. God bless you.